Thank you for taking the time to watch this video on Scarson's Deeper Decision Support System, where we focus on improving decisions, focusing on healthcare delivery and outcomes, and balanced budgeting. My name is Paul Minchell, and I'm the CEO and founder of Scarson. In the middle of March, we pulled a team of experts into a Zoom meeting and all agreed to pivot the resources of the company around building a holistic decision support system that was capable of meeting the needs of any country. And we gave the team 2 months to accomplish that. We're proud to say that we're right on schedule and have built a solution that is very pragmatic, meaning that it can build on the current efforts of lots of different stakeholders while bringing a lot of different improvement, and in particular really adding to the collaboration and teamwork of all of the stakeholders that are focusing on COVID. We have a proven track record of working on a global basis with many of the world's leading life sciences companies. In doing so, we've amassed experience in more than 100 different diseases. This has created 3 core competencies in the fight against COVID. The first is a very disciplined decision framework called DEEPER. This is something we've developed that stands for Diagnostic and Predictive Results. We have expertise in a number of key areas, allowing us to build a holistic solution all the way from community infection through screening, testing, and hospital treatment. Lastly, but probably most importantly, we have an enabling technology with a proven track record that allows us to move incredibly fast. There's an incredible amount of brain power across all the different stakeholder groups in both healthcare and finance that are dealing with the disruption of COVID. One of the main challenges is that it's very difficult to move from reactionary decision making to proactive, and in essence extend the horizon by which you're making decisions. This presents a significant opportunity to improve the teamwork and alignment of all these stakeholders. Scarson and I2E have been working for more than 10 years doing this exact thing in large global companies. So there is an opportunity to tie together the stakeholders and the processes that they support in one unified location. So how do we do this? Well, we have an incredibly agile approach to data management that allows us to unify and automate data, particularly where you're looking at near real-time needs and daily updates on situational awareness. We always ensure that, again, security and compliance around privacy are maintained. We also have the ability to connect very different forecasting methodologies and enable them all around very powerful scenario capabilities. And one of the key elements of COVID is obviously to recognize gaps that might occur between demand that patients present and either the supply or capacity of different elements of the system to support that. We also have very automated time series and risk classification of patients that allow us to implement our DEEPER framework. And the last and potentially most important one is improving the collaboration of all of these different resources, and by doing so create much clearer insights in decision making. This is a sample of some of the experts that we've deployed on the COVID solution. I've been acting as the solution architect in the design and requirements for the different components. Ken's been ensuring that we meet enterprise class standards and has played a real key leadership in the execution of the National Anonymized Patient Record. We've asked Scott, our R&D lead, to jump in and actually code some new agent programs that are going to improve the accuracy in terms of patient flow and hospital demand. And Arsa, who's brought forward his experience in seasonal flu, machine learning, and other data science techniques. And last, but certainly not least, is Maria, who's a PhD mathematician with published papers in modeling techniques for H1N1. Given the life and death consequences in the healthcare treatment and the incredible financial disruption on the government balanced budgeting side, it's important to take a moment to validate the alignment of both expertise and technology. What you can see here is that all the experience that we have and the technology validation translate incredibly well to the pandemic situation with COVID. We wanted to provide an insight on what the team has been working on from a holistic perspective, with a focus on the integrated forecasting components. For us, we were immediately clear on where to start, and that was to design an anonymized national COVID patient record. So pulling all the data from the disparate sources and putting it in one place, and engineering the components of that based on what decision makers would need to use from both a regressive analysis and also looking at forward prediction. We finished the process by mapping out how we would then populate and maintain situational awareness on all of the information that's in the record. Some of that obviously can come from EMR data that's already being tracked. Some would be adding additional information to what's captured in patient interactions, where they could be again added into the I2E solution. Our focus then turned to what are all the different types of forecasting in both capacity, supply, and demand planning that we would need to essentially wrap around the patient. So the first area looks at community infection in the yellow, number one, and then looking at screening capacity more from the standpoint of the physician screening centers and the testing capacity. So when you focus on the yellow in number one, there are obviously many different types of approaches that can be used around this. Our initial implementation is an SEAI-TVR model that we've custom built with Maria's help, with also patient segmentation on it. It's using an ODE approach, differential equations, but we absolutely see progressing that to an agent-based approach. It just was going to take a little bit more time. Again, we're completely flexible to substituting in other methods there or feeds that might be created by other companies that are already working on it. So everything's very flexible. When we then turn our attention to the hospital needs, we've used the progression and treatment behavior in the patient record to inform agents that we have built. So this allows us to use the behavior of different segments to really provide an accurate picture of what you can expect when new patients hit the hospital. That's then obviously supported by capacity and supply planning around staffing and equipment and PPE. As you then look at things like balanced budgeting, there's a parallel and rippled effect in governments, where things like social distancing policy and essential services is now impacting municipal and regional budgeting on both a loss of revenue perspective, things like transit, increased costing, thereby resulting in potential deficits for 2020. And many of these areas, like municipal NAT, are not allowed to run deficits. So there's obviously now issues of potential resource funding allocation. So we've taken two key components, healthcare and balanced budgeting, built it into one integrated system approach, keeping in mind that we can maintain discrete access to everything. In essence, unify an entire country's efforts around the pandemic. So with the plan in place, we quickly moved forward on building the solution. It brings three key benefits to decision makers. The first is to make sure that they're working off of evidence-based information. They also want to understand the risks and then, as best as possible, mitigate those in their decisions. And the third is to provide a much longer sense of decision horizon. So they're not just making decisions about the next few days and next week, but the medium term as well. The last thing we'd like to cover off in this intro video is a high-level overview of our I2E platform, which stands for Integrated Insight Environment. I don't want to get too technical on it, as we're going to explore that more in other videos showing specific content of the COVID solution. What's important to take away from this is at the front end, we're able to integrate diverse sets of data in a very agile way. We can then look at places where we want to capture additional data or do localized forecasting and design those solutions using Microsoft Excel as the user interface. That's one of the keys to how fast we can develop things. We then may have other components where we have more advanced healthcare system models or budgeting models, again using Excel. We also have access to advanced algorithms with Microsoft Machine Learning Server, and in the end, everything goes together in one place so that we can enable dashboards for decision makers, PowerPoint automation reports, and ad hoc analysis. i2E is a very mature end-to-end solution with more than 500,000 hours of use in global life sciences. Thanks for taking the time to watch this video. We'd love to chat with you about how we can support your efforts with COVID. Reach out to us at info@scarson.com and keep checking scarson-covid.com for new content and insights on decision-making support for COVID-19.